So we're going to spend the last little while, and thanks to Dr. Dresser for giving the perfect introduction to what we're going to tackle. It is part of the nutritional therapy component in the health behavior management side of things. So let's have a look. So in my declaration of, so my conflict of interest, I have none to disclose. I'm currently, of course, a dietitian, member of the OPDQ, the Ordre Professionnel des Diététistes du Québec, and a volunteer with Hypertension Canada. So let's make a plan for some time together. I thought we would start by just reminding and having a refresher of what the recommendations are from both CHEP and the Canadian Cardiovascular Society. We'll talk about what some of the challenges are, as it may be for all of us, and then try to maybe reinforce and give you a little extra confidence in your action plan as I give you some of my tips for tackling weight control and encouraging what I call the big five. You will leave also knowing with a lot of the resources, and nobody gets out of the room without taking some of the resources from Hypertension Canada that we have at the back there. All right. Yes. Oh, that's backwards. So the importance of nutrition therapy has been talked about by both. Health behavior interventions remain the cornerstone of chronic disease prevention, including cardiovascular disease, and that is taken directly from the Canadian Cardiovascular Society recent recommendations in 2012. Nutrition therapy is an integral component of health behavior interventions, in case some of you need convincing, and health behavior modification is also reinforced by CHEP, and you remember Dr. Dresser's slide in which just above the drugs was health behavior modifications. So let's have a look at the CHEP nutrition guidelines and the nutrition recommendations. First one is for weight reduction, and our colleague in the back who mentioned that with a BMI of 31, don't you start to try and tackle there. And indeed, you are right on with the CHEP recommendations. Height, weight, and waist circumference should be measured and body mass index calculated. The maintenance of a healthy body weight, which is between 18.5 and 24.9. Anything above 25 puts you into the overweight category. Anything above 30 puts you in the category on the degrees of obesity. Weight loss strategies, never easy, and it is still the big three combination of dietary education, increased physical activity, and behavioral modification. And for the behavioral modification, very often these days, our work with social workers and counselors and psychologists to get at the root of some of those eating patterns really make a difference. So the dietary recommendations, continuing on with the CHEP guidelines, we've seen the weight control recommendations. For the dietary recommendations, we emphasize a diet, no surprise, fruit, vegetables, lower fat dairy, lower fat milk products, don't forget that one. Dietary insoluble fiber, whole grains, and protein from plant sources that is reduced in saturated fat and cholesterol, the famous DASH diet. The CHEP recommendations also target salt intake. Consider, and we would like folks to somehow get to around 2,000 milligrams of sodium a day, which is a huge leap from where most folks are today. Potassium, calcium, magnesium intake, we are always looking at the literature and seeing how things are evolving, and indeed the focus on the importance of potassium and adequate potassium is will likely or is in consideration for the upcoming recommendations. The bottom line at this point in time is that the dietary recommendations focus on food and no therapeutic supplementation is recommended at this time. Alcohol consumption, because we will be rolling into some Mediterranean diet talking a little bit later. The low-risk drinking guidelines, which currently are no more than 2 drinks a day and up to 14 for fellas and 9 for women. The CCS the Canadian Cardiovascular Society, in their recent recommendations, for the first time have spelled out and been very specific in their health behavior recommendations. And data indicate that indeed they really support the fact that abdominal obesity, dietary patterns, alcohol consumption, physical inactivity, psychosocial factors, and smoking are modifiable risk factors for cardiovascular events. For the first time and across all of the risk category levels, low risk, intermediate risk, and high risk categories, maintain a healthy body weight, emphasize a diet rich in vegetables, fruit, whole grains, cereals, polyunsaturated and monosaturated oils, omega-3 fats, particularly from fish, and avoiding trans fat, and still limiting saturated and total fats to 7 and 30% of the daily energy intake. Increase dietary fiber and limit cholesterol. Increase dietary fiber to greater than 30 degrees, that is no small feat to get there. And limiting cholesterol in certain individuals to no more than 200 milligrams a day. CCS gives some shape to those dietary recommendations by recommending the Mediterranean, portfolio, or DASH diets to improve lipid profiles and decrease cardiovascular disease. There'll be a quiz later. So looking at some of the commonalities, so with those words ahead of us, Mediterranean diet, portfolio diets, DASH diets, let's just see what your, just to refresh your understanding of those, what those eating patterns look like. So the famous Mediterranean diet, again, rests on a huge complex carbohydrate, grains and whole grains base, with daily plant-based foods, lots of vegetables and fruit, whole grains, legumes, nuts, healthy fats, oils, canola, lower fat daily. These are all in the daily foods. Weekly would be cutting back and having some leaner fish and poultry as your main protein sources, and then very lean and rare occasions for red meat. Some of our favorite, on the side, we see red wine in moderation. But moderation, let's not get too, it's not a daily thing, and it is certainly much like the low-risk drinking guidelines. A maximum of 2 drinks daily for men under the age of 65. Fellows over the age of 65 have to join the ladies with no more than 1 glass of red wine a day. And they do specify red wine. The other alcohol components are not part of the Mediterranean diet. The portfolio diet was developed by our Canada's own David Jenkins, and it is a very vigorous vegetarian diet that is designed to lower HDL and does a fabulous job lowering LDL cholesterol, blood pressure, and improving blood sugar control. It contains a daily portfolio of foods, of nuts, plant sterols, viscous fiber, and 50 grams of soy protein. It is virtually a strong vegan diet with a strong component of, even getting 10 to 25 grams of viscous fiber, which is the soluble dietary fiber, your beans, your legumes, your oatmeal. There's not much room. There is a definite commitment to the grains and vegetables and fruits. Our DASH diet, which spans the 2 nutritional therapy recommendations, has a nutrient profile that is, as applied, rich in potassium, rich in magnesium, rich in calcium, rich in plant-based protein, and very rich in dietary fiber. It's low in saturated fat, low in cholesterol, low in total fats and added sugars, plus there is an added component of a reduced sodium level. The DASH eating plan, again based, half your plate, vegetables and fruit, lower fat milk, dairy products, or soy every day, whole grains, lean, meat, poultry, and fish. Oh, this is not my slide. Okay, with the fish first, let's flip it around, the fish, poultry, and meats at the last. Add in a handful of nuts, seeds, and legumes weekly, and limit your fats, oils, sweets, and sugars. For those of you that work in French, it's difficult. Well, we are recently producing DASH diet recipes and resources in French, but because it is a U.S. publication, most of it comes from the U.S. at dash.org. You can use a modified version of the Canada Food Guide to, if you stay on the red side of best practices, to achieve the DASH diet in some folks as well. What are some of those common therapy themes? Healthy weight, lots of veggies, fruit, whole grains, lower fat products or soy, small portions of lean meat, fish, vegetarian meals, nuts, and oils and non-hydrogenated fat. Those are the focus. When you put the positive spin on it, these are the elements to make sure that are part of a lifestyle. There's always room for feasting and straying a bit, but the basic profile has to be in the green. And what do we put the brakes on? Sweets, added sugars, alcohol, trans and saturated fats, and added salt and high sodium foods. I'm sure if I had asked anyone in this room whether or not what their idea of a healthy diet would be, I would have heard I would have heard what I had just put on that other slide. I guess what we're up against is that changing behaviors is very difficult. Adherence to nutrition therapies requires effort and commitment, and you are fighting an uphill battle because in general, the eating habits of everybody else around you is less than stellar, very few stars. So indeed, make sure you come to Travis Talk to learn about the best way to tackle some of those adherence and some changing behaviors. The consumer is also overwhelmed with nutrition information, and Canadian food systems are really not supportive of health. Let's have a quick look. If you have a look at the obesity rates, we can see that 1/2 to 2/3 of Canadians are overweight or obese. Look at the 25 to 29, 30 plus men and women from the, this is from the Health Measures Survey. So this is not health reported. This is not reported height and weights. This is actually measured health and weights. So in Canada, we have less than 50% of women who are in a healthy body weight range and about 35% of men. Only about a quarter meet the vegetable and fruit recommendations. When you have a look at what the current recommendations are, either DASH or Canada's Food Guide, most Canadians, and the scale goes up to 100%. When you look at the sodium intake, most Canadians exceed that upper limit, and that upper limit is 2,300 milligrams, not the 2,000 milligrams that CHEP is hoping folks would align with. And that data that was constructed from the CCHS does not even include the salt that is added at the table or during cooking. It's just from the foods that is in the food list. So, and if you pull things together, dietary fiber, saturated fat, sodium, fruit and vegetable intake, and you create this healthy eating index, if you, on a scale of 100, whoa, we are barely in the 50s. And almost nobody gets an A, which is above 80, except several of us older ladies who have been particularly vigilant. But most folks get a D if you give them a ranking. So folks are in an ocean and in an environment where it's really difficult to go against the grain. There is a lot of nutrition information out there. Folks are juggling with nutrient information, food information, lots of soluble fiber, monounsaturated fats. A lot of folks need real guidance as to what does that mean in what I buy or what I put on my plate. You find the nutrient information on a food label to help you make some choices, but you sort of have to know what foods to look at in which those are meaningful. There's often conflicting information, and my favorite, the celebrity endorsements. So you are battling a confused consumer who is really looking for your guidance. So make sure you make friends, find a dietitian, and up close and personal, because you will also have questions as things evolve. But I think your confidence and your guidance will help. Now I encourage you to attend Dr. Campbell's talk after lunch as he tries to give us a feel for the Canadian food systems and how tough it is to support health. The food industry is quite profit-driven. Supersize is the norm. Healthy options cost more. They're kind of slow to react on things like trans fat. We're still trying to move the boat on sodium. Food labeling, advertising to children. Those of you who work in neighborhoods with less, well, food deserts, right? You can't walk to a grocery store. There are many neighborhoods where you can't even get the fruit and vegetables. In my rural community, my breakfast cereals, the 4 that meet my criteria, I can't get any of them there. It's a field trip into Ottawa to be able to stock up. Fast food restaurants are far from the DASH diet. I mean, that one slice of tomato on the Subway 3-footer does not count as a serving. And we've put a lot of, we criticize the fast food restaurants, but all restaurants are high in sodium. It's almost impossible to get chefs to ratchet back the salt. Governments are not yet engaged to support healthy eating and food practices for schools, or if they're there, they're often not enforced. But take heart, I know in this, but take heart. We have 7.4 million Canadians who are living with hypertension. It only took 6.9 million of us to elect a new government. So supposing every one of those Canadians with hypertension took some action to demand an environment that was supportive of some of the dietary practices, I'm sure we could move the marker. What do? Whoever said BMI 31, tackle, you have, even though you know that the chances are daunting, it's a daunting task, as health professionals, you are behooved to mention at visits the importance of taking action on body weight and managing food and lifestyle to cut back on portion sizes. I mean, size does matter. Folks often don't realize how much they're eating. Measure things just to get an idea is not a bad idea. Food journal really helps, and even modest weight loss can help. You don't even have to start changing a lot of what you're doing, but you have to eat less of what you are. So first of all, cutting back on portion size sometimes helps a lot, especially meat, fried foods, sweets, and alcohol. Those are the places, if folks have got a limited resources and are helping, when you're guiding them through making their plan and their commitments, these are some of the tips you can keep in your back pocket. To improve your food choices, I would say remind folks and get them to track on the big 5. And a nice tool for tracking and seeing how you're doing or where you're going is a little checklist that we have created for the back of the Healthy Eating for Healthy Blood Pressure handout, which is available on the website as well. And my big 5, and it's sort of in order of where you should be doing, more veggies and fruit. Really think about how to get that. More veggies and fruit, less sodium, better fats, daily milk products, and whole grains and the whole grains and legumes. Tackle those, and I think and you don't have to tackle them all at a time because it's extremely overwhelming. I mean, think of your own eating habits and how you would feel if somebody came at you with all of that of information. Parse it out. Really, more veggies and fruit every mealtime. Breakfast, lunch, dinner, and have it for snacks.
fresh or frozen, stay away from the higher sodium canned foods, especially the juices and soups. Number 2 on the big 5 is less sodium. You really, and these days, the way to do it is to read labels. It's really tough. Vegetables and fruit, fresh meat and fish. That's about the only thing you can say really doesn't have much sodium in it. Everything else will, if it's tackled by the food industry. And the only way to figure that out is to read the label. Look at the portion size, and then look at the sodium content. Aim for foods with 120 mils or less than 5% daily value. Those are your best choices. The further you get, the closer you get to 5%, the better it is for the food choices. In restaurant or takeout, the sodium will be high, so you have to eat less and do more. We're having a lot of so you have to pack lunches and snacks. My truck driver, not construction worker, but my truck driver actually used to bring a bag of apples in the truck with him and eat those instead of stopping for a Timmy's. God love him. Better fats includes both the meat side of things and the added fat side of things. So the better fat means to choose more of the fish and poultry more often than lean meat. And soy products, nuts and seeds often. Get a nice tofu recipe. Love edamame. Bring back the pea soup. Bring back the baked beans. I mean, some folks are not going to do the Broadway production of meals, so make sure that you identify with them what kind of legume or soy they can incorporate. One of the pieces that is the scourge of the local dietitian is those deli meats, right? The ham stuff. Fresh. So choose fresh or frozen or lower sodium canned fish. Oil. Is, insert name of oil here, good for me is a common question. Olive oil and canola oil, basically on the same plane, those non-hydrogenated margarines. Corn oil is also in the portfolio diet because some of those stanol contributions. Oil, most often, olive oil in a muffin recipe, not so good. Canola is a great Canadian option. Limit your use of butter, lards, shortenings. So that's mostly in baking. So cut back on portion sizes, more veggies and fruit, half the plate for sure, and lower sodium. Then you can roll in some of the other pieces. Better fats, daily milk products. So it's mostly yogurt and milk and cheese intake to real cheeses more than cheese slices and cheese whiz, which is more of a whiz than a cheese. And then you can begin to change the whole grains and the legumes. I mean, legumes, everybody knows you should be eating more beans, peas, and lentils. It's really tough to get folks there. Start by maybe just a vegetarian spaghetti sauce. Take off no more meat, just pile on the legumes and lentils. Again, read your labels. If you're looking for a higher fiber food, look for at least 2 grams of fiber and no more than 3 grams of fat in your whole grains cookies. There are lots of resources at your disposal. Do check out the website at Hypertension Canada. There's a lovely public site as well as resources for you as health professionals. Thank you.
We have